You're listening to Biotech Hangout, a live and unedited weekly discussion of all the latest news in our industry with a group of biotech insiders. I'm Daphne Zohar, and my co hosts today are John Maraganore, Mike Yee, Sam Fazeli, and special guest John Crowley, the CEO of BIO. For more information about our hosts and guest speakers, or to listen to the most recent episode, please go to biotechhangout.com. Despite some deals highlighted by J&J's $14.6 billion purchase of Intra-Cellular, market sentiment was muted with poor performance from some companies like Moderna, Lilly, Sanofi, and also smaller companies like Viking, as well as other small biotechs that were down 20 to 30% on no news. We're going to dig into the deals soon, but Mike, what are your thoughts on the week and overall sentiment?
Well, first, thanks for having me on. It's great to be on again, and after quite a busy week. Um, my thoughts coming away from the long week, number one, as you were saying, I am not sick. I feel great. And the weather in San Francisco was phenomenal, so that was echoed by everybody. So that was just a really great, refreshing change to the conference. More importantly, I guess I would say that I felt sentiment amongst the client base there and companies, in my opinion, was about a 5 out of 10. I look forward to everyone else's opinions. I'd call it a 5 out of 10. Daphne, stocks were hit pretty hard going into December and into January. And then I believe Monday and Tuesday was pretty rough again, and Wednesday had a little rebound. But despite the M&A that you just mentioned, it was pretty rough. And so you have that side of the equation that it feels like here we go again. So that was a bit challenging on one side. The other side is also, I think, people looking forward. I think there is a bit of a debate about the optimists who would say things are already bad. Um, a lot has already been priced in on the negative side with RFK. And also, valuations are actually pretty cheap these days. So I think there was a good discussion and healthy discussion amongst a lot of investors and clients about where we go from here. Like I said, it feels like a 5 out of 10. I do feel we're a bit on the upswing, but I'm certainly not calling it a raging bull market. But I feel like people were pretty optimistic about the health of the year given the overall broader markets are doing well. People feel that the administration is probably not going to come down too hard on the industry and that RFK may dial back some of the rhetoric. I think there was a Wall Street Journal article commenting about at least two people in the administration who are maybe getting pushed out because of too much negative rhetoric, and that hopefully the administration will be a little bit more common sense as we go forward. So I felt it was pretty good start to the year, Daphne, despite the stocks going down, and I am fairly optimistic about the rest of the year.
Yeah, I want to come back to you on the IPO window because I've been hearing it's pretty tough and that it's going to be a while until we see a bunch of IPOs price and do well in the
Mhm.
post market. Then until then, it's going to be rough going. Any thoughts on that? And then I'd love to actually hear
Mhm.
from John Maraganore about Metsera and just generally what's happening in the private
Yeah.
investment community. Go
So
ahead. Yeah.
let me comment about the start of the year without going into too much detail. Obviously, Jeffries and what we're working on here is a huge pipeline of things that are expected to come through. And I would say that there was a bit of a foot off the gas pedal in December and the plans for January. You saw two private biotechs get taken out on Sunday. Not sure how much is publicly disclosed, but of course, it would be reasonable to think that those two companies were trying to go public, and therefore, given the state of the conditions, took a nice number up front to get acquired instead. So I think that's pretty interesting. And in fact, there's a number of private companies. We have a whole list that were getting acquired over the last 6 months as a reflection of the fact that the capital markets are a little tough. So there has been some foot off the gas pedal. That said, I think to my comments at the start, I think we're watching this. I think people do expect that we will get back going here, and I do know that I guess Metsera and some of these others. I'll let John comment, but we will get back on track here, and I expect some deals to start getting underway.
Yeah, maybe, maybe Daphne to follow up on the Metsera question, but maybe first more broadly. I mean, I just came back from that meeting, and look, I agree with Michael in the rating of a 5 out of 10 is probably right. I think people entered the meeting with a lot of uncertainty around the policy environment, and we're going to hear from John later, which is super great. And look, I mean, I think, actually, we bookended the week with, first news about Cavazzoni resigning, and then some positive news about Crowley being invited to be part of this, discussion group around FDA for the future. So, to some extent on the FDA side, we'll wait for John to talk, but maybe we should be, we should pause before we panic, and maybe there's reason for optimism. And the markets, of course, are still jittery around interest rates, and so that's factoring into things. But there are green shoots, and Metsera is filed. They flipped to go public, and they presented some data last week that may support this concept of a once monthly GLP, and that story, of course, was very dynamic during the meeting as well. So I'm reasonably optimistic that we'll see high quality good stories get out. We did have some good IPOs last year. Bicara is one that I've been involved with that I'm really super excited about. But it's been a tough capital market environment, and it will almost certainly remain discriminating, and more challenged until we get better visibility on interest rates at the end of the day. But I'm excited about where Metsera is going to go, because that could be the first one that goes out this year.
Yeah, and it's important that the first ones that go out do well. One question I had, I actually bumped into Josh Schimmer and Tim Opler and Brad and a bunch of others at our biotech hangout party. And we were talking about XBI and how XBI is underperformed now for 3 years in a row. It's down about 3% so far this year. One thing that Josh said, which I thought was pretty interesting, is that the XBI is not a good litmus test for biotechs. And he was saying that the average biotech was up last year. I think he actually mentioned you, Mike, and saying he got that data from you. Do you know what he's referring to?
Yeah, so I will say that we and our client base continue to look for a great indicator that well reflects the biotech sector. There are not great, I'd say, baskets or index funds. XBI is created uh, for many years, created as a equal dollar value. And so everything is weighted to, for example, one. And then therefore that takes away market cap weights. And so what was also interesting is that every, I believe, 90 days, the whole index all got rebalanced again to 1.0 for every stock. So you have a constant every 90-day rotation of about 130 stocks that were getting rebalanced irrespective of size. uh, 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 what happened recently was that they then shifted, I think actually just a few months ago, shifted to much more of a market cap and liquidity weight. It's a bit of a complex equation. And so here again, not a perfect indicator, but leans now more towards larger caps rather than say maybe the 200 SMID caps that we might focus on and discuss here. Again, I think it's 130 if you want the exact number of stocks. So I agree with Joshua. I guess he was referring to my data. That does suggest that again, it's not a perfect indicator. Here was an interesting one though, Daphne, because I think the XBI was ended what +1% or something like that. So it was right on the border. But it was definitely a bunch of baskets of haves and have-nots. There were great numbers of winners, Daphne, but also a ton of losers. And so when you weighed it all out, it came into about 1%. But we're still looking for a good one, and I guess XBI is still what we have.
Yeah, thank you for that. Sam, any thoughts on general vibe for the week?
Yeah, so I've been obviously watching it, Daphne, from a distance, not on the ground with you guys, but we do have a very active client chat in it. At one point, somebody said, why don't they just stop the conference because it's killing a whole bunch of stocks?" I think that was on late Tuesday afternoon or early Wednesday. And I think a lot of that is just on the back of the downgrades and the guidance that folks came out with. Obviously, right out the door was Moderna, and then Lilly, which didn't help, and it dragged a whole bunch of stocks down. But in terms of sentiment, I'm going to have to defer to you guys because I wasn't there to take the temperature.
Yeah, sometimes I think those that are watching remotely they have more time to actually read up on all the news and follow what's been happening. But I felt like generally the vibe was, yeah, I would say I agree with Mike's 5 out of 10. You know, on the one hand, the Monday started off with some deals, which we'll talk about in a moment. And I think people were excited about the science, the fundamentals, but you could probably juxtapose that onto the last few years. And the question is, how does that translate into, general sentiment, stock performance, et cetera? So I felt like that part of it was a little bit more negative. But let's go to the
But
main.
Daphne,
Yeah, go ahead.
just
Yeah,
before you go ahead,
yeah.
given that we spoke about them, etc., how do we feel about the first IPO test being an obesity name with a GLP-1, given what we've heard at the conference, Pfizer say, a variety of companies talk about, and then of course the questions with regards to all the other obesity companies that are around. How do we feel about that? Is that a good start?
Well, I would love to hear from Mike and John. I think that the obesity space has definitely kind of the bloom has come off the rose a little bit in terms of the competition, the level of competition. But I still think there's going to be some big opportunities. John, you know this company specifically, so do you want to comment on that and then go to Mike?
I think we
John?
might have lost John.
No, I
I
think
mean,
he's
he's
on mute.
there.
Yeah.
Yeah.
All right, Mike, do you want to go first?
Yeah. So I want to make two comments. First is I do believe that the challenges that you're seeing with the performance of the group starting on Monday is absolutely in part due to the uh, higher for longer interest rate environment and the macro. And I use the term that the macro has the steering wheel. And I think that a lot of the volume and a lot of all of this stuff trading week to week and month to month is just all of the same biotech funds, specialists, and hedge funds, and very much less to do with all of the bigger money that we wish was involved in the group. And so what happens is on Monday and Tuesday, yeah, you had some deals, but there was no follow through. And you'll actually see, and we might get to some of this, Madrigal sold off hard, Viking's been selling off hard, and a number of companies that were quote unquote supposed to be takeouts all traded significantly down because, oh, I guess they're not getting taken out and there's no support. So I do believe that the interest rate environment, the lack of generalist support, who continue to be much more focused on tech, certainly in the large cap space, Magnificent Seven, and a whole bunch of other groups that are benefiting from the rising tide of the market in the Trump administration and much less focused on biotech. So I do think that's an important dynamic. The second thing, as it relates to Metsera and the general appetite for obesity as an IPO, I would say that the did you say bloom coming off the rose? That is, I think, right. I think you have obviously just had now two straight quarters of Lilly disappointing, and so down 20-25%. You're going to take foot off the gas on that group. Amgen down, a whole bunch of stocks all down on that, but nobody doesn't believe that this is going to be a huge and massive market. So if a small company with a GLP-1 or whatever version of GLP-1 you have, in some cases there's guys with weekly, some people a bunch of injectables that they have a successful drug that moves forward to phase 2 and phase 3, then that will create value. It's just all going to come down to, are they going to be 1 billion market cap, 600 market? What is the valuation to start? Because that will be the most sensitive part, certainly the first year or two.
I mean,
Make
you know,
sense? Yeah.
the maybe I could just jump in, and I missed the first part of this, but I think that there's no doubt that this is going to be a massive market over time, and the quarters and the ups and downs. I mean, even Nvidia's got ups and downs in quarters, and we just have to be conscious of the long game here. The penetration of these drugs is still a fraction of where it can go. And so I think there's no doubt that this will be a very big and dynamic market for many years to come. And companies will have to differentiate with what they bring forward, and they'll get rewarded if they do so. And that's the bottom line. That's why Metsera is going to be an exciting story in the first part of the year. But there'll be others too. And even the entrenched leaders like Novo and Lilly will have enormous success in this category.
John, just to cap this, Dave Ricks, I can't remember in which conversation, either on their presentation or on Bloomberg TV or with the stat team, I put it very succinctly. He said, somebody asked him about CagriSema, and he said, look, anyone who tries these incretins, you're not going to get magic, but you're definitely not going to get disappointed. Now, I don't want to, I'm paraphrasing here. I don't know exactly the words that he used, but frankly, it's just going to be a game of, I want a piece of the market share.
Yeah.
So, yeah. Okay,
Yeah,
cool.
and I think I think I couldn't agree with Dave more, and I think it's a question of how does one play in this sector right now in this growing space, and but it's really just the beginning innings of this story at the end of the day, which is what makes it exciting.
Yeah, and it's such a big area that affects so many people. Somebody was commenting that a lot of their colleagues have look like they've lost weight and have mentioned that they're on some of these new obesity meds. So it's a big area. So let's move to the deals. We'll start with the major deals, starting with J&J's $14.6 billion purchase of psychiatric drug developer Intra-Cellular. So first of all, I'd like to say congratulations to the team and CEO Sharon Mates. And I'll mention here that if you guys were out and about, you would have seen a lot of people wearing pink, and that was the Biotech CEO Sisterhood out in force. So I think there was about 500 people at a group picture, but it's a big change from a few years ago when I think there was more men named John or something like that presenting at JP Morgan than women. I don't know if you remember that.
Well, I remember because I'm named John. I do
Yeah.
remember that. But Daphne, are you still wearing your pink?
I'm not, but I did wear it, and I wasn't wearing as bright a pink as everybody else, but I was there in the crowd, and this is a great group, this Biotech CEO Sisterhood, which was organized by a couple of colleagues, which maybe we'll mention them afterwards. Go ahead, John. Though, what were you going to say? Did you
No,
wear pink?
I wasn't going to say anything other than just asking you if you are still wearing your pink. But I think if you guys plan on doing it every year, which I hope you do, that's good news because then we can all, we supporters can all go out and buy some pink attire to join on that
Yeah,
event.
I think every Tuesday at JP Morgan from now on is going to be pink, so that
Fantastic.
it's a little bit less boring to look out on Union Square. I think we might have John Crowley joined through a Hangout. Is
Hi,
that you, John?
it is Daphne. Hi, everybody. Sorry I'm a little late with technical issues logging in, but great to be here. Thank you.
Yeah, welcome. We were just about to go to Intracellular, but before we do, any thoughts? How did you spend the week at JP Morgan, and any thoughts on general sentiment?
So I, for the first time in a couple of decades, actually did not go to JP Morgan. So I was out. I had a couple of speaking commitments around the country, and one in New York, one in Florida, and then some time in Washington.
Okay, well, we're going to come back to you because we're very eager to hear from you about your thoughts on the administration and all the concerns around
Great.
China. So we'll come back to that in a moment. So as I mentioned, J&J announced that they're going to buy Intracellular for $14.6 billion. Intracellular's lead asset, Caplyta, is approved in the U.S. to treat schizophrenia and bipolar depression. The company also recently asked the FDA to expand Caplyta's clearance to include major depressive disorder, which affects about 10 times as many people as schizophrenia. And they had some really good data recently. This would be the largest acquisition of a biotech company since the Karuna BMS deal and the fourth multi-billion dollar acquisition of a CNS drug developer in the last year or so. And 2024 was a bit of a roller coaster for companies in the neuroscience space, with the M&A side, Cobenfy approval, and interest by pharmas being very positive, juxtaposed with some setbacks with regard to data for a number of companies in this area. Pause and open it up to the group to comment
Yeah.
on. Yeah.
Definitely. Just let me ask. You're obviously CEO of a neuropsych or neuro company, if you want to call it neuro. I think it's neuropsych. Um,
Yes.
how do you feel about the challenges and opportunities in the space in general? Having obviously had a hand in Karuna, and then now a new company, and having seen this deal, how do you feel about how this is going to shape up? Some folks have told me that they think the next decade will be the neuroscience decade.
Yeah, so we talked about obesity, and similar to obesity and hypertension, neuropsychiatry and neuropsychiatric disorders affect a major part of the population. There's hundreds of millions of people across the world affected by just depression and anxiety. So, and if you look back, you can see that these have been among the most commercially successful and widely prescribed drugs of all times. So, pretty much every drug approved for depression has been a commercial success, with some reaching mega blockbuster status. And at the same time, clinical studies in this space are very difficult. They're challenging. You have to have experience with the issues that come up. So, for example, patient selection, making sure that you have patients that actually have depression and that you're not enrolling patients with inflated ratings or what are called professional patients. Dose selection, high placebo response is a huge issue. So if you're intervening with patients too much, you're going to get higher placebo responses. We've heard a number of studies reporting issues with compliance. So I think that it's an area that's very challenging for clinical development. There's something like 93% failure going from preclinical to clinical proof of concept. I won't comment specifically on my company, but I will say that one of the areas that I'm very encouraged by is that there's been a number of drugs that have been advanced and could make a major difference for patients, but have some issue that we can now solve with today's technology. And I think, xanomeline was a perfect example of that with the, advancement of CAR-XT. And I think there's many other examples like that, and that will be helpful because you're starting with clinical data. So, someone, as a side note, someone was joking that clinical development in neuropsychiatry is tough, but when you have a success in late stage clinical development, it's worth about $14 billion. So that's a joke. But,
For
um,
40.6.
yeah, 14.6, right. So, any other comments on this deal before
Well,
we move? Yeah.
I have a couple comments. One is, I think Bruce Booth, as he often does, is such a great historian for the industry. But he did a very nice tweet this week, congratulating Sharon, of course, which is terrific, but also commenting on the value creation story. And I found it striking that they raised a grand total of $1.2 billion, private and public at the end of the day, which is an incredibly capital efficient. I mean, they've been around since 2002. They were originally funded by Moshe Alafi, of all people, going back to those of you that are old enough to remember who he is. But it just amazing story at the end of the day. 13x in less than 12 years at the end of the day. So, congrats to Sharon Mates. And as a founder CEO as well, I think that's also particularly special in these circumstances. Just one other comment, which is I was really happy to see the guys at Jefferies participate in this deal as well. Give it wasn't it, Centerview was involved, of course, as well, but it wasn't just them. There were others involved too, which is always a good sign for how the field and the M&A banking lineup is evolving over time.
So I
Great.
guess I get to comment on that.
You do.
All right.
Congrats.
Yeah, I guess that brought Jeffries into the conversation. No, first, more holistically, Daphne, look, it's great to see a large transaction get done. The headline was, biggest transaction above 5 billion now since, I guess, correct me if I'm wrong, would that have been probably Karuna Saravel, right? So the three biggest transactions, generally speaking, were neuropsych. But it shows you that a big pharma is engaged in this space, highly interested. Those molecules, I guess, Cerevel to a lesser degree, the two of those transactions were de-risked, and speaks to the commercial opportunity, speaks to pharma engaged and doing deals. So it's not like, where are the deals? There you go. And yes, I did also get a lot of public press there in Financial Times about Jeffrey's involvement there, which had in part to do with Phil Ross, who had come from J.P. Morgan. So that was quite an entertaining article in the FT. Yep.
Yeah, congratulations. By the way, somebody was pointing out that Eric Tokat from Centerview has stopped tweeting all his deals. I don't know what happened there, but that
Hmm.
was always fun. We look for his tweets in the morning of JP Morgan saying that there were some good deals happening. So let's move to there was a couple of other M&A deals, and as you pointed out, Mike, they were private companies, which is probably viewed as a bit of a bummer for the public investors. And there's been sort of a big number of biotechs that were private that have been acquired over the last few months. And you had mentioned a couple of these companies were set to IPOs. Let's talk a little bit about GSK and IDRx, and then Lilly's Scorpion. Do you want to kick it off, Mike, and then Sam?
Well, yeah. So I just wanted to say again, starting high level first, is that it speaks to right off the bat on Sunday that two private companies that, for all intents and purposes, without getting too specific, were slated to go public, and what happened, right? So that is, if the capital markets were great, they were going to be heavily subscribed, and it was going to be a huge IPO performance, then typically, and maybe John could speak to it, they pass on the M&A perspective because they're going to get a great valuation and go up and can raise more money. So that speaks to what I said, is that the IPO market is a little bit challenged, and therefore they look to the exit of M&A. And pharma has been all over this, and so maybe it's a comment about how pharma believes that a lot of the other public companies have either been picked over, or, as I like to say, everybody knows the M&A targets and they're all overvalued. And so pharma has a tough time going after those because everyone's picking and looking at the same ones. And so they end up going smaller, tuck-in, less risky, I'd say, smaller tuck-ins, and therefore can pick those up on the private side where they don't have a public valuation. So that speaks to the conditions of the market. And I'd also say, because I know there's on our agenda to talk about a whole lot of other licensing deals, so that's also been a big a topic, is that Gilead specifically has not only just did one deal, but they've done a couple now on the small side. AbbVie, J&J, and a bunch of others also doing that too in the inflam space. So the three themes I saw coming out of the last week and the last couple weeks were: one, private companies getting acquired; two, a whole lot of licensing deals getting done instead; and three, is a whole lot of China formed companies. So whether that's China Nuco and then coming over to the US, or China assets that are being found or licensed and then brought over to pharma, whether as a new company standalone or getting done through pharma. I think that's really interesting. And that is definitely a big trend that's happened in the last, say, 3 to 6 months.
Well, let me pick up on that and we'll go to
Really interesting.
China.
Yep.
Yeah, let me pick up on that. We'll go to China and then we'll come back to the other deals that happened this week. So, and really interested in hearing from John Crowley here. So, China has been a major topic of discussion. I would even say concern. Pharma is now sourcing nearly a third of external molecules from China. Over the last year, $6 billion of licensing upfronts went to China companies. This competition didn't seem to exist in the same way before. And I think the sentiment is that in prior years, the money would have gone to XBI companies. And the concerns for U.S. biotech were highlighted when Merck bought an oral GLP-1 in December from Hansoh for 112 million upfront, and that caused Structure Therapeutics and Vikings, who had both had multi-billion-dollar market caps, their shares to fall sharply. We've seen this trend in other areas like oncology, where China sourced compounds are now going beyond Me Too to meet better. And it was actually interesting to see Innovent in the news this week with the Roche deal, 80 million upfront and a billion biobucks for an ADC from China's Innovent. You'll recall China was very much out of favor after Lilly returned rights for a PD-1 inhibitor to Innovent in 2022 after it was rejected by FDA due to FDA criticism of China only data. And this had blowback on EQRx, who was pursuing a strategy of cheap drugs from China at the time, basically crashed that company. I was really interested to see that Alexis Borsi, who founded EQRx, and I think IDRx, by the way, is now at Curie Bio, and he's now warning companies not to publish any data on new mechanism drugs and be very ambiguous in patent filings to protect from really fast follower Chinese competitors who can move faster at a lower cost. Their clinical trial enrollment apparently is speedier, supply chain staffing costs are lower. I want to go to John Crowley. I would like to get your thoughts on what policy initiatives are in play that could protect U.S. biotechs. I know the Biosecure Act is still potentially on the table for March, but that's not necessarily going to address this concern. So would love to hear your thoughts on China in general and any policy related initiatives that you guys are pursuing or that you're aware of.
Sure, Daphne. I'm happy to comment. I think maybe to begin, we can just start with, there is of course a broad geopolitical amount of tension and competitiveness between the United States and China, and we play into that. So our industry isn't unique in this regard. And I can tell you, in my now nearly a year in Washington, including my day one working on the biosecure challenges and opportunities, I've not in quite some time, if perhaps ever, seen as bipartisan focus on a particular strategic issue. And the guiding principles are for us in our industry that biotechnology is incredibly important. It is a national security asset, and you need to care. And when I say you, that's from the general public to policymakers, lawmakers. And these are the points I kind of continue to hammer home in all of our conversations on anything touching our industry, is that you need to care about biotechnology for the public health, of course. You need to care as a matter of national security and as an instrument of national security. And you need to care for the economics and the economic growth aspects of a broad, strong bioeconomy. I think another broad principle that we've tried to emphasize is, this is not xenophobia. This is not unfounded fear. There is a strong strategic competition. China has stated now for many years that they intend to become the world's center of excellence in biotechnology. The United States, and together with our allies, we continue to lead in biotech. China plays a really important role in this ecosystem, but we have to maintain and advance our lead. The last kind of guiding principle that I used in both private and public discussions on these issues is to just state that, again, we believe that the world is a better, safer, healthier, and more prosperous place when we continue to lead. So then you get to what are the policies? Now you've got biosecure, and you saw where we've come from that. I think with the position that we took back in March, again, it gave us a voice in the conversation, and it gave us credibility on the issue. And with that, we were able to shape that so that, for another key principle, that we do no harm to patients, no harm to the biomedical research establishment. And I think as you saw the final versions of Biosecure come out, we all agreed, if it does become law, it's something we can live with. With respect to Biosecure, I would expect again to see pretty strong, overwhelming bipartisan support in the House. Senate is much more of a challenge, as we've seen before. Senator Rand Paul, in particular, and a few others have been opposed to it for a variety of political and in Senator Paul's case, as libertarian principles. So I think while we might see it come up again, I think likely here in the next few months in the House, it seems with respect to the biosecure law that the Senate will still be a roadblock. The only likelihood of it actually becoming law, I would think, is if it gets tacked on to probably a year-end defense appropriation. It fell off the last NDAA, back a couple of months ago. So, whether Biosecure becomes law or not, it likely in its current form or anything near to it would have a pretty limited effect on our industry. And for the things you guys, we were just talking about kind of the emerging biotech advantages in China. You highlighted one, Daphne, in particular, the pace at which they can they can enroll, and they can complete their clinical studies is really remarkable. And it's a major strategic advantage for them, and something we need to think about as we think about our whole ecosystem and changes. From a legislative standpoint, just briefly, we will see tariffs. We believe that President Trump will issue many, perhaps up to 100 or more executive orders day one when he comes into office on Monday. There is the potential that he could issue an order declaring a national economic emergency. If he does that by executive order, he then has the authority to invoke what's known as the International Economic Emergency Powers Act, and that could give him pretty broad authority to enact new tariffs. So, what that would be and the impact on our industry broadly, we'll have to see. We're prepared for a whole variety of outcomes. There is another, and the last I'll comment here with respect to policy that could be important here are rules and restrictions on outbound investments to China, including in the biotechnology field. That has been a challenge for Congress. There was a member of Congress, Chairman McHenry from North Carolina. He just recently retired from Congress. He was adamantly opposed to any legislation blocking outbound investment. On the other hand, Speaker Johnson, this has been one of his key priorities. In fact, limits on outbound investment, including to China, were part of the December continuing resolution discussions. That fell off like a number of other key parts. We expect that it'll come back. We think they'll garner support in the House. Again, there will be stumbling blocks in the Senate to this. Unclear is what Secretary Bissett, with his experience as a successful hedge fund manager, what his point of view would be on this. I've not seen public comments for him on this. Um, but ultimately, I think the bottom line is, it's relatively limited in terms of what we can do from a policy standpoint in the early days to limit the growth of biotechnology in China. I think the better way to look at this is what can we do to strengthen our ecosystem, and there we've got some really big bold ideas, and we're getting great traction. So I'll pause there, Daphne.
Yeah, let's pick up on that. What we can do, for example, to address speed of clinical development and FDA reform. It sounds like you're going to be more involved with the administration and be able to provide some input. What are your thoughts in general with regard to FDA reform that might be a positive for our industry,
Yeah,
or negative? I'm being optimistic. Love to hear your thoughts.
I, I'm optimistic as well. I won't or can't right now comment on any role I may play advising the administration or any discussions I've had leading into a new Trump administration. But look, our basic principle since the election day has been that bio is a cross-partisan organization, and our job is to advocate and develop policies that advance biotechnology to find common ground. I spend a lot of time with Democrats and I spend a lot of time with Republicans, as does our team. And my view here is one of constructive engagement. While there may be some people, some nominees, and others where we have concerns from a policy standpoint, sometimes very serious concerns, there are ways in which we can vet those privately, and if need be, publicly, if they run counter to our beliefs and our core structures. But I think it's really one of constructive engagement. And the one that you brought up, right, the FDA, we've been working for the last year. One of the things I did last year was a series of listening sessions around the country and hearing, where are the challenges for us in biotech? And there are many, but also where are the opportunities? And again, what would you like to see addressed? And we've now begun, and Daphne, you've been a key part of this, and John as well, with our board and our executive committee. And you'll see one of my key priorities now coming into the new year is a broad template, an initiative we call Bio Advance, with a number of key cornerstones, two of which are ensuring the resiliency of the supply chain. And again, I think there's a lot we can do to ensure the resiliency of the supply chain here in the States and among our allies. But another key component, and probably the number one thing I heard for more than 100 emerging company CEOs in these listening sessions was that we have to reimagine the clinical trial and regulatory paradigm. That we've evolved to a point where it simply costs too much money, takes too much time, it's too uncertain to develop our medicines. So let's really think bold about how we do it. We need a strong and effective FDA that has to continue to be the gold standard around the world on safety and on efficacy. But let's think about, how do we reimagine clinical trials? How do we think about condensing enrollment timelines? How do we think about IRBs, university contracting? What's the role of the CRO industry here? And then within the FDA, how do we strengthen leadership? How do we reduce bureaucracy? How do we really elevate regulatory science and take, in many ways, our science and our medicine coming out of our companies has leapfrogged the FDA's ability to digest and process and evaluate our technologies. And it's defaulted to a very slow and cumbersome system. So while protecting patient safety, ensuring we understand efficacy, let's understand, right? How do we use, when is it appropriate to use biomarkers, accelerated approval, adaptive clinical designs, Bayesian statistics? And let's approach this with the same mindset we did in Warp Speed years ago in COVID. That we need safe and effective medicines, therapeutics, vaccines, but we need them as quickly as possible, and we need them for everyone. So those are kind of the core principles. So I'm optimistic that, and based on the discussions I have had, and some going back 8 years to the early days of the Trump administration, showcasing, for us early on, it was our family's personal journey and the world of rare diseases, and now it's much more broad than that. And I am optimistic that this fits in with priorities of advancing science, realizing the importance of biotechnology. And again, I can't overemphasize enough that the part of when we talk about the importance of biotech for national security, again, showing what free democratic societies can do to promote public health and again, a more prosperous, secure world. So there will be challenges. We've got to carefully follow how they think about MFN and these tariffs. But I think addressing the FDA, the clinical trial paradigm, addressing fixes in the IRA, Congress now is going to look at the IRA. I'm confident we're going to have hearings on 9 versus 13 on orphan cures. And between Congress and between the White House, I'm hopeful that we can find solutions that'll really advance medicine. Other initiatives that pediatric review voucher is incredibly important for us and for a number of our members and for patients. And I'll just end with you. There's going to be a very large tax bill this year. It's probably going to take some time to pull it together. I do believe that we can address the R&D tax credit in this construct, but also too when we get back to manufacturing and incentives for manufacturing in the United States. I think that's going to be an important vehicle. So let me pause there. But with while still plenty of challenges in front of us, I'm optimistic that I think we can be in a better place and move the ball forward in a way that'll really help our industry.
Thank you, John, and thanks for all the work, the important work that Bio is doing. It's great that somebody like yourself, who's a drug developer, who's advocated on the part of patients, including your own children, and understands the industry so well, is the one who is leading this organization. Let me open it up to others for comments and questions, and we also have a question from John Connolly, who heads up the Parker Institute Science Group there. He's the CSO there. So I'll open it up. I think Sam and John, Michael first.
Look, I mean, I just want to make a comment. One, thanking John Crowley again, as you did, Daphne. It's fantastic to have him involved here on this issue. And John, as you know, I mean, I believe that these type of initiatives done well, science driven, focused on the evidence generation in a very solid, important way to maintain our gold standard status is going to be critical. And I do think that these type of changes can evolve the U.S. environment for success in the biotech sector, which really allows us to continue to be the leader around the world in what this industry does. I mean, I believe in more. carrots and less sticks as a way of dealing or addressing concern around our standing in the world as a leadership in biotech. And I personally, I have no doubt that we will continue to be the leaders in biotech, even if other countries like China come up with some really good solutions to innovation, which should be part of the global innovation economy at the end of the day. But if we have an environment in this country that enables our sector to continue to be the most successful in the world, that policy environment will allow us to continue to be in that pole position, and that's what we should strive for with more carrots, as I look at it.
No, John, that's very well said. You and I are 1,000% aligned on that.
So, John, given that alignment, are you confident that the administration understands that, and that the nominations that have been out there may understand that despite the rhetoric, and that maybe the markets are too jittery, and we will see some visibility and resolution?
I am. I think that'll become increasingly clear with a number of the policies. I think if you look in the weeks ahead to the Trump administration approach to the entire drug development paradigm, I think you'll see it very aligned with how we see the world. And for those reasons of the public health, national security, economic growth and security, that's resonating in many, many discussions over the last several weeks and months. So I think you'll see that. Look, I won't comment on specific nominations. Obviously, we're very closely attuned to that and are involved behind the scenes in many discussions. But I am optimistic that we can find common ground on a lot of these key areas. And to the extent that any nominee or any member of an administration or Congress takes a point of view or tries to implement policies that run counter to our core beliefs, whether it be in vaccines or other areas, we will absolutely be the first to be vocal about how that does harm and to oppose those policies. So that's been my approach going into this, again, grounded with constructive engagement and finding common ground and that cross partisanship. You look at the end of the day, at the end of the day, I think politics is about making friends and finding that common ground. It's easy to be the opposition and just oppose everything and everyone, but we take the world as we find it, and we take Congress and the White House as we find it, and we find a way to work with it.
So one of the reasons that folks have gone to China for some of the assets that they're licensing, CAR-Ts or ADCs, etc., T-cell engagers, is because of the speed with which they can generate some early clinical data. And I think, and John Connolly's just joined, because he and I were chatting a little bit about this issue, and I think there's some initiatives that are going on, John, to try and address that in the US, right?
Yeah, absolutely. So, and I just also want to reflect, I just want to thank John for just such a careful analysis of the regulatory environment, its impact on the biopharma sector. And I'm also optimistic. I'm very much looking forward to the opportunity that these changes may make. And Sam, as we were talking about, there really obviously the speed at which we can do some of these clinical trials ex-US, it just really, it obviously is way ahead of what we're seeing here. And I think a lot of that has to do with regulatory agencies that have come up and looked at the gold standard of the US, looked at exactly what the good things that the FDA does, and implemented many of those policies with alignments with US regulatory standards and tolerances, but at the same time began to look at how we can accelerate things a little bit further. So if you look at, I think many of us are familiar with clinical trials in Australia, but Singapore, Denmark, many other countries, take a look at more of a risk-based approach to really speed up the early phase signal finding studies. So we are in the cancer immunotherapy space, and I think many of you know that a cell and gene therapy trial signal finding study out of Penn it takes about 2 years to really push through the idea that you have just a small signal finding study. And in that time, as an early stage biotech or as an academic, you've got 20 companies that have already done that trial in China. And much of this has to do with the way early stage trials are done in other countries outside the US. And that is those 6-person, 12-person signal finding studies are done really with local IRB approval under a framework that is nationally administered and reviewed. And so I think that this is something that we really have to look at now is what are the responsibilities of the local hospitals, and can we shift some of that regulatory burden early phase signal finding studies onto more of a local review process that may be much accelerated, including other aspects like timelines, condensing timelines. This is a big area that that we really need to address. There's a role for looking outside the U.S. at other systems and what works, and then bringing that in and modifying our system. And again, I really am optimistic. This is the time where, as John said earlier, we can use carrots to really incentivize this as opposed to continually putting up barriers.
Thanks so much. That was John Connolly, CSO of the Parker Institute, who joined us here from the audience. So we have about 10 minutes left. I'm going to ask everyone to comment on anything else that's on their mind, and then we will wrap up the show. So I'll start with you, Sam.
Yeah, so I could do these deals quite quickly. Gilead's deal, and I'm going to focus on this China, Europe versus US issue. Gilead did a deal with Leo Farm, which is not a US pharma or biotech company. It's private for, which I think the thing that makes it interesting. Now, others can correct me if I'm wrong, and this is sort of thing where Tim will have all this data in his head. $250 million up front for a preclinical asset. Now, it's an interesting asset. It's a STAT6, oral STAT6 program as a whole. And obviously, STAT6 is the downstream of IL-4, IL-13, which is Dupixent. So the idea is interesting, but that sounds like a pretty big number for a preclinical asset. And then the other one, which is also not a US one, is AbbVie and Simcere, which was actually, they did two deals, two T-cell engager deals, one with Simcere, which is Chinese, and the other one with AbCellera, which is a company that they had a deal with already. And they're both for T-cell engagers. And of course, AbbVie is in the world of T-cell engagers with a myeloma drug that they're developing. And in the deal with Simcere is for a myeloma triple or a tri-specific GPRC5D, BCMA, and CD3. So these are the deals that I saw. Again, it's just first few deals of the year, and not US companies. And I think that doesn't really say anything. I think the US biotech still win the largest share of deals, even if you look at the big rise in 2024. But it's something that we're going to have to keep assessing and analyzing going forward. And did you, Mike, did you have any comments on the Gilead deal?
Yeah, the 125 is definitely a high number for preclinical. I'm sure we all know that. It follows off some of the themes we were talking about because literally weeks before, J&J did a deal with the Chinese company for the oral STAT6, and they paid a much smaller amount. I think it was like 30 or something like that. So maybe someone thinks that the drug is better, or maybe J&J just went cheaper, but J&J went to China to do theirs, and Gilead went to do Leo, and whatever they wanted, they paid up for it. So that's good. I do like that deal for Gilead though, because they have the STAT6 and they also have an IRAK4, I believe from Nurex too. So if you've been following, everybody wants an oral psoriasis or atopic dermatitis pill because there are not great ones at all. Good.
Any other closing remarks, John?
Yeah, I would just say, look, this is the start of the year, and I think there are reasons to be optimistic here, and despite the uncertainty that we all entered into at JPM, and my glass is still half full, and looking forward to some great stuff happening.
Great. Well, thank you. Before we close out the show, I just want to give a shout out to my friends over at Omega on the Scorpion deal. Congratulations on that. And to mention that the founders of the CEO Sisterhood, Julia Owens, Angie Yu, and Sheila Garathi, have done some great things for the industry. So I want to give them a shout out as well. So we're about to wrap up, and I would like to thank my co-hosts, John Maraganore, Michael Yee, and Sam Fazeli, and our guest speaker, John Crowley, CEO of BIO, and then John Connolly for coming up. Thank you all for a great discussion, and really appreciate your insights. Looking forward to the rest of the year. I think potentially a little bit of optimism. John Crowley, would you like to make closing remarks to wrap up the show?
Sure, Daphne. Again, thank you for having me. I'm happy to join on a more regular basis. And look, I echo John's optimism. I think the glass is more than half full and probably pretty clean too. And it's been a challenge for 4 years. You look at, when we reach the peak of our biotech market, everything that we've struggled with, despite tremendous science, technology is moving forward. I do think, for instance, you'll see a much more receptive Federal Trade Commission that will understand the importance of recycling capital and ideas in our industry through M&A and large business transactions. One of the things that we're going to emphasize, I'll just note as well this year, is that while we do a lot and we're based in Washington for a reason, of course, so much of biotechnology is happening around the country. While we have our epicenters in Boston and the Bay Area and a couple of other places, when I travel around the country, I see so much optimism. And when I meet with our governors in particular, everybody wants biotech in their state. They want it to grow. So one of the initiatives we're going to launch this year is a program I'm calling Bio on the American Road. And I'm going to go on an almost monthly basis to spend 2 or 2.5 days in emerging cities and emerging biotechnology centers of excellence. We're actually going to pilot this in early February in Denver, where we're going to meet with state leaders. We're going to go on morning talk shows. We're going to tell very human stories of people locally who have been saved through the miracles of our medicine and people who need our miracles for they or their children to be saved. We're going to go to children's hospitals. We're going to go to member companies, but emerging biotech companies with members of Congress to showcase the work being done in their districts and states. So we're going to do Denver and cities of in that emerging category. So I'm optimistic. I rarely hear anybody ever say, if ever, that God, I hate that biotech company that made that medicine that saved my kid's life. No, never. They need more of it and they want more of it. And I think that's the background that we will weigh into as we kind of continue to deliver our medicines and hope to people. So I am optimistic, and I think while we'll have challenges, no doubt, on the policy front and things we need to fix, like in the IRA, I'm optimistic that with some smart and bold change, we'll be in a better place. So that's our job, and that's my vision. But I ran a biotech company for 20 years, right? I've got to be an optimist.
Hmm. Well said. Thank you, John. And we would love to have you on here again on a regular basis. So thanks to all of our listeners, and we will look forward to seeing you next week on Biotech Hangout.